Greetings, and thank you so very much for asking for my participation in this very important meeting and gathering of the Connectional Sons of Allen. It is my privilege to present this topic on Healthy Men 2022 for your body. I have provided some bullets and highlights, but more importantly, I have provided resources that are embedded in the PowerPoint. I have sent the PowerPoint forward so that you all may find the resources, follow the resources, see to your particular need, and then do the homework assignment that will follow. Well, matter of fact, I'll give you the homework assignment now so that you will know what is going to be expected of you. And I am asking Brother Monroe Miller to invite me back in the not too distant future to see whether or not you all have completed your homework assignments. The homework assignment is to check each and every item that I will be discussing. See if you are on target. See if you are following the recommendations. See if you have access. If you do not have access, I am recommending that you contact in the US and around the world, your Veterans Administration, your health insurance provider, your public health provider, just about everywhere where we serve around the globe has access to resources via the state, province, county public health departments. So please do so. That is your homework assignment. Check the boxes. Make sure you are doing what you need to do. With that said, let me now share my screen. We will be discussing, as previously stated, the Healthy Men, What You Need to Do 2022. So, we'll talk about overall wellness. We'll talk about health screening for particular age groups. Then we shall talk about the immunization schedule recommendations. We'll talk about prostate health, and we'll end with COVID-19 prevention. So overall wellness, what do you need to do? You need to maintain your recommended screening schedule. We'll go over that in a minute. You need to assess whether your risk for future medical problems exists and then decide what to do about it. But part of assessing your risk is to learn your medical family history. We talk about family history, who begat who, especially now in this month of February. We talk about what is my lineage, where do I come from? But what's also important is to talk about your medical family history. Who in your family has prostate cancer? When did they develop it? Who in your family has high blood pressure or diabetes or one of the many, many, many inheritable medical conditions that exist? When you draw your family tree, we talk about family trees all the time. When you draw your family tree, make sure you ask the questions, who had what and at what age? That determines your screening schedule. If there is an early family history of prostate cancer, then rather than looking at the recommended overall screening schedule, one would need to back up 10 years. Same thing goes for breast cancer. Men do get breast cancer. Do you have a family history of that? Is there a history of colon cancer? Again, same thing. Whatever the screening schedule is, subtract 10 years, That's when you need to discuss, that's when you need to just start that. But you also need to create a relationship with your provider, your physician, that ensures that your physician knows that information so you get the proper care at the proper time with the proper screening. And hopping in and out of emergency rooms is not the best way to create a relationship, because it does not provide you with continuity of care. Someone learning you and you learning them, so that you will know, one, whether or not that's the best medical home for you, and whether or not that is a person who is listening to you, so that you can get done what you need to do. In addition to that, you have to follow a healthy lifestyle. Are you eating properly? Are you exercising most days of the week? What kind of exercise are you doing? It does not mean you have to go out and run, but it does mean you have to do something. Even if that's chair exercises for those of us who have bad knees, we must do something. We have to cut down on the high fat, high carb foods. We need to stick to diets that will allow us to move forward. And we need to maintain our vaccine schedule. We've been talking a lot about COVID vaccines, but that is one of many that needs to happen in order for all of us to be protected in this world we live in. Health screenings for men between the ages of 18 and 39, you see it's 2 pieces long. Are we doing these things? Are we screening ourselves for hypertension and doing blood pressure checks and making sure we're in the right range, like 120/70s? Are we checking our cholesterol, not only just the total cholesterol, but our HDL and LDL, the good cholesterol and the bad cholesterol? If there's a family history of early heart disease, have you had an EKG, an echocardiogram? Have you been to the doctor and held those conversations? Does your cholesterol need to be lower than what is normal for someone else who does not have that family history? Do you have a personal history of heart disease and therefore need to be further controlled? Do you have a history of diabetes? Have you been screened? Do you know? Do you have that family history is important for knowing how frequently you need to check. Do you need an A1C because of that family history? That's the 3-month average sugar test. Do you need to should you be having your diabetes screening done with a blood test or a finger stick? Or can we just do it at the church? The answer to that is yes, if we're talking about screening. But if someone develops symptoms, they need to get the full workup. Diabetes impacts blood pressure, it impacts heart disease, it impacts stroke and nerves and tingling in your feet, and all kinds of other conditions are related to what happens with diabetes. So screening is important. The earlier it is identified and controlled, the less likely there are to be problems later in life. Dental exams, we've now learned over the last several years, it's been many years now, that poor oral condition leads to problems that are related to heart disease, not only valve problems, but it increases the likelihood of cholesterol plaque building up. Have you had your annual eye examination, or every other year, depending on your history? Are your immunizations up to date? Have you done the infectious disease screening? Depending on your age, one should have a hepatitis C test, HIV, depending on one's risk factors. We are talking about this in the church, but listen, the most important thing we can talk about in the church is making sure that we understand that our behavior impacts infectious diseases, to include HIV. Have you had a routine physical examination? Testicular exams. It has been proven that self-testicular exams do not provide much care and input that needs to be done in your physician or other provider's office. Are you doing skin self-examinations? And based on your family history, in this age group, do you need colon cancer screening and prostate exam and PSAs earlier on? Excuse me. Between the ages of 40 and 64, it changes just a little bit. Now we add osteoporosis screening, thinning of the bones. We add skin exams are no longer under the self-exam schedule, but under the exam schedule done by your provider. We've added lung and colon cancer. For lung cancer screening, it's based on occupational exposure as well as smoking history. Yes, we're in the church and we know that folks smoke. So are we talking about lung cancer screening? Are we talking about exposure from asbestos and other chemicals that men are more likely to be exposed to than are women? We need to make sure that we are talking about colon cancer and colon cancer screening. The age is continuing to be dropped in terms of when that screening begins. Make sure that you are doing your stool tests and or your colonoscopies. Multiple ways to get that done now. Please, I beg of you, make sure you are doing that. And prostate cancer screening testing falls now in this category. 40 to 64, your recommended screenings increases. The infectious disease screening for hepatitis C, making sure that one is not at risk for liver cancer, that becomes even more important in this age group. When we look at those men over ages 65 and older, this list changes just a little bit because now we've added hearing testing and abdominal aortic aneurysm screening. The abdominal aorta is that vessel that goes from your heart down to your legs, where it moves into both legs, one or the other, obviously. But if there is weakening of the wall, you will get, a person can develop an aneurysm. And if that bursts, it is very likely to be detrimental to that person almost immediately. So we add over 65, same screenings, but now we are adding hearing testing and abdominal aortic aneurysm screening. Immunization schedules are found on CDC's website. This is the link for the schedule that is most legible for the common person. These four symbols dictate what you need to do, or whether it has no recommendation or it's not applicable to that age group. There are recommendations based on age, documentation of vaccine or lack thereof, and lack of evidence of past infection. There are also recommendations for those who have additional risk factors or another indication like occupation in the healthcare industry. There's also recommendations based on clinical decision-making that you and your provider must make together. So here we go. Annually, an influenza vaccine. The dose and the type is dependent on some variables. The tetanus, diphtheria, and pertussis, DTaP or TD, is based on whether or not there's been a wound, whether you've recently had a TD or a Tdap booster, which should occur every 10 years. Wounds are what cause tetanus and diphtheria to become detrimental if one develops a wound without a TD booster. Measles, mumps, and rubella, the MMR, again, is dependent upon age. It's also dependent upon whether or not one is born after 1957 or later, will determine the number of doses. Also, whether or not someone is in a closed environment, like being on a college campus or in a military housing situation. When you look at varicella, which is the chickenpox vaccine, there are 2 doses if born in 1980 or later, and then again later in life. The zoster, varicella zoster vaccine is done at 2 doses. The HPV, the human papillomavirus, should be done at a earlier age, and 19 to 26 or through 45. So up until age 45, the HPV vaccine is possible. The 19 to 26 is more recommended. After 27, it's based on a conversation with a provider. The pneumococcal vaccine, that which predominantly causes pneumonia in especially the elderly, should also be given as a preventive measure in the younger years, and then possibly another dose beyond age 65, or if one is diabetic. Hepatitis A, hepatitis B, meningococcal is related to, again, back to, are you around an environment like a college campus or a military dorm or other close situation. Those are the things that will vary based on whether or not you need a primary, a secondary, or even a booster vaccine. H-flu is also, again, dependent upon location, exposure, and occupation. I have provided for you the link to these are screenshots from that link. Please go to that link, again, part of your homework assignment, and look at the notes. Look at what these symbols mean for your particular age. Ask your congregant, ask the members of your Sons of Allen whether or not they've done the homework assignment. Do they know about the homework assignment? Share this PowerPoint with them. When we start talking about COVID-19 and we start talking about the primary and the secondary series, or primary and booster series, in the United States is primarily Pfizer, Moderna, or Janssen, which is otherwise known as J&J. Pfizer can be given for over 5 years. We are waiting on the information that will become for the 6 months to 5-year group that is due to be released soon, whether or not that will be authorized or whether or not it will remain in clinical trials. The primary dose series is 2 for Pfizer and Moderna. The difference between the 2 Pfizers that are listed here is the size of the dose, the dosing itself. After additional primary dose, and those who are immunocompromised, those who have had transplants, who are on immunosuppressive agents like high-dose steroids and others like that, will need another primary dose. That means their primary series consists of 3 and that does not include the booster. The J&J or Janssen is not recommended for the immunocompromised for their what would be their additional primary dose or secondary dose. It is recommended that that dose be either Pfizer or Moderna. When we begin now to look at AstraZeneca, which is another prominent COVID vaccine that is used around the world, that has been activated by the World Health Organization, especially in areas where the AME Church is found. AstraZeneca is one of the primary vaccines that is also given in addition to the Pfizer and Moderna and J&J. 18 years or older, the dose interval is 8 to 12 weeks for the 2 doses. The second dose can be a Pfizer or Moderna, and the AstraZeneca can be used as a second dose for any of the COVID inactivated vaccines that are found around the European Union, Sinopharm, Sinovac, and Bharat. If you need more information on AstraZeneca, I have provided the WHO information link for you to be able to determine and look at. When you look at vaccine boosters, in addition to that, which I just described for AstraZeneca, people can receive the Pfizer or Moderna after 5 months, or the J&J after 1 month. Pfizer and Moderna after 5 months, Janssen, J&J after 2 months. The use of a Pfizer or Moderna booster is preferred over the Janssen J&J vaccine for the booster. Still possible to get it, but only between for the ages of 12 to 17, only the Pfizer biotech is allowed to be used. Shifting now, let's shift to something that is particular to men, prostate health. The International Health Commission has been in relationship and partnership with the Prostate Health Education Network in the United States, but they now also have a presence around the world. ProstateHealthED.org is their website. They have begun to do their presentations and partnering with us to help educate on that which is available regarding prostate health. This website has all kinds of information: how to stay healthy, what questions you should ask regarding prostate cancer treatment, what clinical trials are available. There is a wealth of information. There is they do a seminar once a month in June, which is recognized as Prostate Health Education and Prostate Cancer Prevention Month, the month of Father's Day. Here in the US, they do a series of plays around educating and making it fun. Those are all recorded and available on the website for anyone to review and learn more information at any point, at any time, 24 hours, 7 days a week. That is available around the globe. So anyone in the connection for free can access this information. Additionally, according to the World Cancer Research Fund, prostate cancer is the second most commonly occurring cancer in men and the 4th most commonly occurring cancer overall. Why do I raise that? I raise that because in 4 of the countries that the AME Church has a presence, 4 of the top 20, we have a presence: France, Barbados, French Guiana, and the Bahamas. The United States and other parts of the world are right behind that, but the top 20, we have 4 of the 20, or 1/5, belong to AMEs. The strongest evidence is that body fat is a cause of advanced prostate cancer. Another reason for us to eat a low-fat diet, a healthy diet, increase our fruits and vegetables, reduce the amount of dairy products that we eat every day, maintain a healthy weight. Remember, the more your BMI, your body weight, in relationship to your height, the higher the risk of prostate cancer. Exercise most days of the week. That increases blood flow. It helps to maintain your weight. And ask and speak with your physician directly about your individual risk, your family history. Back to that again. Make sure that we are determining all of these things. And when we talk about COVID prevention, things don't get any different than what we've been saying, but let me just reiterate and review the mask issue. An N95 allows only air leakage in and out around that mask between 1% and 10%. A surgical mask, you know, those blue masks folk are wearing, that's about 50% of the air is going in and out around the mask. A cloth mask rises to 75%. In wearing that, please note that the more someone is exposed in terms of time to an infectious person who is having particles containing virus from their upper respiratory system go into the air. If no one is wearing anything, there's 15 minutes. A cloth, everyone has a cloth mask on, it's 27 minutes. A surgical mask takes you to 40 minutes. The N95 that is commonly available, or the KN95 that is commonly available to the public, gets you about 3 hours. But an N95 mask that is fit tested, which is what is being worn in the hospital, carries up to about 2,500 hours of protection. That's not available to you. However, unless you're on active duty military. However, to get 250 hours of constant contact with everyone wearing a KN95 or an N95 that's very available, 25 hours is a lot of time. However, that also means that it has to be worn constantly and properly. Don't wear that mask properly. Put it under your nose like a lot of folk are doing. It further decreases the contact time that is available. The numbers tell it all. I also noted today that in Denmark, it just was released, that they released all of their protocols, and their COVID rate is higher in the world right now and rising. Please wear your mask. Having difficulty finding an N95 or a KN95 mask, one of the things that is not commonly known is that if you leave a mask that you've worn for 8 hours in a paper bag, you know those old paper bags we used to take with us to school, for 3 to 4 days, that mask can be used again. And it can be used 5 times if that cycle is being utilized. Well, who's going to remember 3 to 4 days? Not many of us. So therefore, try to get 7 masks. Mark each bag Monday through Sunday or Sunday through Saturday. And then every Monday, you can use that mask again for 5 times. Every Tuesday, go into the Tuesday bag. Make sure that you have washed your hands after handling the mask, because if the mask is doing what it's supposed to do and you have been able to wear your mask properly, if there are any particles on the mask, you do not want to take that mask off, put it in the bag, and not wash your hands, because guess what? The virus is now on your hands. And the minute you touch your face, your nose, your mouth, that's an area for potential contamination. The graphic and all of the how-to guides are on this link. It is a newspaper article that has done a very in-depth, pulled all of the science into a user-friendly detail of graphics and user guide, so it is understandable and accurate. We can do this. Remember that COVID is not over yet. Get vaccinated, encourage others to get vaccinated, adhere to all the public health recommendations and beyond. Wear an N95 or a K90 mask. Wash your hands or use 70% alcohol sanitizer frequently. Remain physically distant. Respond and prepare. One of the things about the Sons of Allen is you all do a lot of our response work. You do a lot of our preparation work for security, etc. Please respond and prepare like this as well. And overall, respond and prepare for your health. Does everybody remember their homework assignment? Your homework assignment, just again, for those who may have tuned in late, there is a homework assignment. And that homework assignment is to ensure that you have looked at the recommended prevention schedule, the immunization schedule, ask your family its medical family history. And when asking that, not just the disease, but age of onset. And then take all of that information to your healthcare provider and say, this is what I know. Tell me what we're going to do next. If your healthcare provider says, oh, there's nothing you need to do, and you have many circles where you know that there are things missing, push the envelope. And if the envelope won't open, you might want to consider another provider. Thank you so much for the opportunity. There are other tools here for tracking COVID in your area. Both the Johns Hopkins and the WHO have wonderful sites. The different tests that are available is on the WHO site. It actually has a video that goes with it. Dr. Carol Eccles and Visions AME in Houston provided us with a cleaning preparation for service video. In addition to that, all of this information can be found on the Health Commission website. Actually, some of it is still missing, but by next week, it will be there, as we are in the process of making the website more user-friendly. And you know, when you increase and make changes on a website, sometimes you have to take stuff off in order to put it back on. But we are actively working on making it user-friendly. Go to the ministry's link on the website, and then you can click through and access all kinds of information, to include, because of time, I did not discuss the Alzheimer's and dementia partnership we have with the Alzheimer's Association, but come join us on March 20th at 3 p.m. Eastern time. We will be recording it so that those around the globe can also access it, and come learn about Alzheimer's, the resources that are available, other dementias, and how we as a church body, connectional body, are addressing Alzheimer's and other dementias. That's March 20th at 3 p.m. Eastern. Thank you so very much for the opportunity. Thank you so very much for the ability to come before you.